That's because we have the online audience. Buenos días. Good morning. I understand that we have this YouTube channel in English and Spanish. So just give us a couple of minutes to set up and we'll start soon. Para los presentes acá, vamos a tener presentación.
Those who are present here, the presentations will be both in English and Spanish. If you need interpretation devices, you can find them outside the hall.
Need interpretation, please make sure that you have interpretation device. We're just waiting for a couple more minutes and we'll start soon. Thank you. El fotógrafo nos está invitando para una foto mientras esperamos para el inicio de la sesión, así que si podemos hacerla ahora con todos los panelistas, la señora viceministra. Ready? Bueno, muy buenos días.
Good morning, colleagues. Good morning, everyone who are listening to us, those who listen online. Again, we have interpretation services and we'll have presentations both in English and Spanish. To those present that need interpretation devices, you can find them outside the hall. And those who listen to us online, we have a YouTube English and Spanish channel. Thank you so much. It's a pleasure to moderate this session today. Our session is called Strengthening Climate Resilient Health Systems, a call for collective action. My name is Daniel Buse. I'm the head of climate change and environmental determinants of health from PAHO, based out of Washington, D.C. We work with 35 countries and 18 territories in the region of the Americas in this topic. The World Health Organization has identified that climate change is the risk factor posing the greatest threat to the health of the population and people on this planet. In the last report of the United Nations on climate change, it is clearly shown that over 3 billion people live in high or mid vulnerability conditions to climate change, including over 222 million people in Latin America and the Caribbean. We know, especially that in our region in Latin America and the Caribbean, that the main drivers of these vulnerabilities are poverty, a lack of access to services, and the combined effect of bad quality of air, lack of proper housing, a lack of water and sanitation services and hygiene, and the lack of universal access to universal health services. Usually the populations which are affected by all of these factors combined, leaving us with an immense debt with the population of the Americas, and that we have to treat them, because climate change, on top of it, adds risks to these populations. What we see in the region of the Americas is an increase of the number of cases of diseases sensitive to climate, both vectorial and non-transmissible diseases, non-communicable diseases, as well as extreme climate events that affect the populations in many different ways. But today we also want, beyond commenting on the risks and challenges that we have within the field of climate change and health, we also want to discuss and hear from our distinguished panel members about solutions on positive messages that we can really harbor hope to reverse these scenarios. We want to learn from successful experiences from many different agencies and many different partners who are present here today. The event is co-organized by PAHO, the World Bank, the United Nations Programs for the Environment, the Climate Change Framework Convention for UN, and the Clinton Health Access Initiative. We would like, in particular, to thank the government of Panama for hosting us and providing this opportunity today. To begin, it is my great pleasure to invite Dr. Ana Riviere. She is the representative of the Pan American Health Organization here in Panama, so that she can offer some welcoming remarks and then continue with the event. Thank you so much. Good morning, everyone. It is a pleasure to be here. My name is Ana Riviere. I am the representative of PAHO and WHO in Panama. It is a great pleasure to be here with all of you in this event which is very relevant not only for Panama, but for the region at large. And above all, to thank Panama and its government for always being the great host of these events, very important events, big scale, not only regional, not even national, actually global. Those who participate are representatives of countries around the world, and It creates a lot of interest. A lot of people do come. And of course, a lot of work for the country as well. With the full welcome we all receive. I wanted to mention as well, on behalf of PAHO and the WHO, it's climate change and the social and environmental determinants of health are one of the most important pillars of Dr. Gerbros, about these 5 pillars that he mentions in his mandate. And one of the key topics on the preparation into the future of health systems. We have areas in the Latin American and Caribbean region which are very sensitive to climate change and its consequences. This could be extensive and broad in scope. We may have the most well-known effects, as usual, for example, in climate change in terms of an increase of some communicable diseases, vectorial diseases, because of change of habitat, due to changing temperatures. We may have diseases that we didn't have before in places that now we have. We have to go beyond this. What we need to take into account is that the effects of climate change also has implications at the infrastructure level, health infrastructure, and we must take this into consideration with investment in the future, 10, 20 years into the future. What is happening? What will happen? How will we be able to take care of all the people in our country, our region, our locality? How are we going to take care of them if we don't have a health system and infrastructure that can deal with climate events that can be like an increase in rainfall, hurricanes, an increase on sea levels? We must take all of this into consideration because this doesn't happen overnight. This takes a long period of time and it needs consensus, it needs work, a roadmap in the long run so that we can invest as the as the health sector into these infrastructures. And I say this because we usually focus in theory on the direct effects, like I said, infectious diseases. But in the long term, we have higher morbidity and mortality because people with chronic diseases cannot be seen because they don't get the health supplies, not even to the health personnel to identify early these pathologies so that they would have less burden in the future, both to people and the health systems. And this is another of the key points that Dr. Jarvis always mentions, and it's also a pillar of his agenda, is primary care in health, how to bring people closer to quality primary care, and as soon as possible, as early as possible, to avoid that these chronic diseases evolve into diseases that have a big load emotionally and financially for people and the health systems alike. And with these words, I would end my opening remarks, thanking always the presence of the Vice Minister of Health. We know their agendas are very complicated, especially because to the current situation in town. So we are really thankful from the heart. Thank you so much, and hopefully you will be able to enjoy the full week and this event in particular, so that we can offer new guidelines into what is the roadmap of climate and health. Thank you so much. Thank you so much, Dr. Ana Riviere. Now we have the honor to ask the illustrious Dr. Yvette Berrio, our Vice Minister of Health of Panama, so she can offer also welcoming remarks and what will inspire us and guide us to kick off this panel right away. Thank you so much, Doctor. Please come up to the stage. Good morning, everyone. Well, first of all, to thank all of you for your presence here today. Thank the organizers for choosing Panama for an event such as this that fills us not only with pride, but also with a great sense of responsibility as government, as a country, as a nation, and for the technical team, for the Ministry of Health, a great responsibility for everything that this entails. Of course, the alignment of what is going to be happening during this event will be established by those present. We do participate just like you, and we are here to learn, to receive the core message of this event that will help our country, our government, our system to be a health system which is more resilient, knowing full well the effects of climate change is generating in our planet. And these changes have been basically man-made, and we have to seek a resilient way to face this and move forward so that we can offer to the future generations a more healthy world. Having said this, I'd like to offer special greetings from the President of Panama, Mr. Laurentino Cortizo, our Minister of Health, Dr. Francisco Sucre, and also on behalf of the full Ministry of Health, to thank your presence to the event. As said, climate change is an urgent matter that is affecting our planet, our region, and it has diverse and many important effects and impacts on health. We are facing a critical situation which demands immediate attention, and the numbers that we are up against are alarming and require urgent response. The COVID-19 pandemic has reinforced the urgent need of universal health based on the fundamental principles of primary care in health and deeply rooted in a significant commitment with policies and equitable practices and systems of care which are of high quality for everyone. We live in the most unequal, unbalanced region in the world. Wealth inequality, political inequality, and social inequality are rampant, despite that the region is showing signs of economic recovery and better social indicators. It is still facing a lot of challenges. A so-called triple planetary crisis of climate change, loss of biodiversity, and pollution are affecting everyone's health, as well as our planet's health. And these effects are amplified by deficiency of infrastructure on health systems to promote health and prevent diseases and respond effectively to the crisis, disasters, and emergencies. This is a powerful reminder that the way in which we live and we organize our society and produce and consume goods are intricately related to health in general. And our health and the environment health are linked to health of people. This underscores that as a society we are as weak as our weakest link. That's why we must effect transforming exceptional efforts to safeguard health of those who live in vulnerable conditions, and in particular in countries with less socioeconomic development and inadequate infrastructures. Oftentimes, these are the same regions that don't contribute much to the crisis but carry the heaviest burden. Putting in perspective the need of equity to face these challenges. The effects of climate change in health affect disproportionately communities in vulnerability situations like the poor, migrants, or displaced, ethnic minorities, women, children, and elderly who live in poor conditions. Those who have the least capacity to protect themselves are the same ones who run the greater risks. For example, a child born in 2020 will experience, on average, double the time of forest fires, 2.8 times more exposure to bad harvest, 2.6 times more drought, more floods, because more heat waves throughout his or her lifetime in comparison to someone who was born in 1960. Panama is not immune to the impact on health because of climate change. For example, we can consider indigenous peoples communities from Carti area to Tuku in the special territory of Gunayala, a full population of an island which were displaced because of effects of climate change. We have seen an increase in temperature as well as heat waves and an increase of vectorial diseases associated to climate and risks associated to the reduction of rainfall. Panama City has faced risks which have been increasing in quality of air because of fires during the dry season coming from the landfill in Cerro Patacon, as an example. Sanitary systems must respond to the results of health due to climate change, and thus must be resilient in order to be prepared for collective actions which are concrete and to respond to needs of affected populations, such as we detail as follows. To comprehend and monitor the effects of climate change on health, to prepare the sanitary systems, to anticipate, respond, recover quickly from the meteorological extreme phenomenon and other impacts, improve safety and security, and get the facilities of health systems to become more environment friendly, to become operative before and after disasters, and not to contribute to greenhouse effect gases, which is the main cause of climate change. To inform and train people on the effects of climate change on health and on the actions to prevent these harmful effects and to promote health. Work with other sectors for the reduction of exposure to environmental threats and the promotion of health. Increase financing to the health system to be able to face these effects that climate change is producing in our planet. We must work together to be able to develop and foster policies and regulations which are respectful of climate, as well as driving innovation in clean technologies, energy efficiency, and sustainable practices. For example, the promotion of sustainable standards on the supply chain, which could incentivize private sector to reduce their carbon footprint. The exchange of knowledge and best practices in health, the environment, and other sectors which are determinants of health are important not only to share experiences but also to learn the ones from the others. In this point, we thank the accompaniment of Dr. Anne Riviere-Cinnamon and the representation of PAHO in Panama, of her work team, and in general, PAHO, WHO, and as well the one provided to the countries in the Americas, with whom we expect to continue the promotion of actions to handle or manage, prevent, and overcome the impacts of climate change on health. Working together, we create new alliances following a shared vision of wellness and well-being for all. We can contribute to a more healthy and resilient world. Thank you so much, and welcome to Panama, and let this be a successful and useful journey for all our countries. Thank you so much.
Thank you very much, Madam Vice Minister. These are very inspiring words in order to continue with our panel. I would like to start, and I have the honor of inviting Mr. Luis Miguel Perez, who is the Regional Director for Latin America and the Caribbean from Clinton Health Access Initiative, CHAI, in order to follow up with the panel, and then we continue with the second panel, and we will then have our colleague from the United Nations for the words for our closing. So please, Luis Perez, it is a pleasure to have you here. Good morning, everybody. It is a pleasure and an honor to be here. I think it is a historic moment that we have to relate climate change and health. Again, thank you very much to Panama and the team, Madam Vice Minister, to be here, showing the clear commitment that the country has regarding this. And this panel that I'm going to moderate that shows the opportunities, the challenges that are represented by the Latin American governments to confront the health effect in the population will follow a hybrid method. You will have the in-person presence of Madam Vice Minister, and we will also have in the panel guests who are connected through the virtual platform. Please confirm if we have the presence of everybody online. Excellent. Perfect. So, if you'd like, Madam Vice Minister, if we can begin the panel. You're going to be alone here with me, and then you're going to be accompanied virtually. As Madam Vice Minister is with us, I would like to present again myself. I'm Luis Perez from the Clinton Health Access Initiative in Health. And for those who are not completely familiarized with the work of the organization, we work in 36 countries globally, supporting the governments in their clear mission of saving lives and improving the living conditions of the people of the population, specifically the link between climate change and health. We are working with other organizations such as Health Finance Coalition and also innovative initiatives in order to aid the countries such as Climate Health Impact Lab, through which, of course, we continue providing more input, innovations in order to implement them in different countries. I think that the words of inauguration speak a lot about the different challenges that the region is confronting. And so definitely I won't repeat the same thing over, but I will make an emphasis to those populations in areas hard to access or difficult of access with native cultures that are very much affected by climate change, such as extreme heat, storms, drought, on the other hand, which affect your daily life very much, and which affect their daily lives very much, and their forced to look for different alternatives of living. So the migration is done both ways. It's not just looking for new horizons and new countries, but also within the countries. Also, there we have migration from rural to urban or semi-urban countries. 80-90% of the population live in these urban, semi-urban zones. But we hope that 90% go through in the coming years. Of course, the life conditions, the conditions of life, and the infrastructure, as Madam Vice Minister mentioned, they're not adequate. They're not the best, and we need to be leader together with the countries, and we need to understand how to support and improve the conditions of access of health in these populations. I was saying, I was looking into the importance of the phenomena of El Nino, and it is evident the risk that it brings forth for many of the countries in the region, and of course there will be an affectation in the health of the population. We are looking into seeing how, from the human standpoint, but also in terms of productivity, work, increase in mortality in adult populations over the age of 65, vulnerable people, how this is affecting for these people, and so how governments are actually preparing in order to confront this reality. A very important topic that I want to bring forth is that, I want to, in addition to conversing about the opportunities and challenges, is also funding. Currently, only 2% of the funding directed to adaptation of climate change go towards health. And in general, only 0.5% of the total amount of funding to climate change is directed to these type of initiatives. This is something that obviously we need to talk about. We need to manage this in different entities, because there are opportunities of improvement, but there are opportunities that we know that need to be achieved in the following years. And we also know that the challenges that many governments have in order to access these type of funds, and these meetings will help us to be able to understand how to facilitate the access. Before presenting the panel, I just want to go back to the words of Daniel at the very beginning, that this needs to be an opportunity, and I would like to see it that way, to see how our panel is going to really work for a better tomorrow in the opportunities that we have as a government. And then we will have a panel precisely for the agencies of the cooperation agencies and organisms that are supporting this initiative, in order to look at it in a more historic way, to see how do we support and how do we strengthen our healthcare systems based on the changes that are coming through. Without further ado, I will be presenting the panel that is with me today. Obviously, Vice Minister Ibel Berrio no longer needs a presentation. I mean, she already presented herself a while ago, and she gave us inspiring words at the beginning of this meeting. However, the panel, I would really request the panel online to please briefly present themselves, their name, the organization, the role that they have, and also share a few words before beginning the panel. So if you'd like, please, Christina, in order of the way in which the images appear on my screen, Christina, can you please be the first one to present yourself? You're on mute. One moment, Christina, please. We are checking on issues related to audio. Christina, let's try again. Can you please speak up? Perfect. Good morning. Can you hear me now? Yes, of course. Thank you very much for this invitation. My name is Cristina Rodriguez, Director of Adaptation to Climate Change and Certification from the Ministry of Environment from Peru. And well, from the ministry, we have a very deep coordination with the health, precisely to implement the climate agenda in terms of health and climate change, and to talk about the and of course we will be talking about this in the panel interventions. Marina, please. Thank you so much. You're on mute, but I don't know whether it's a technical problem. Until we can fix that, please, Carlos. Good morning, everybody. It is a pleasure to greet you online. My name is Carlos. I am the advisor of environmental quality in the Ministry of the Integrated Central American. We are here cooperating with many partners. We've been working together, and from this platform, we support a lot of intersectorial work, and also it helps us to work with many sectors of health. Thank you. Thank you, Carlos. Marina, I don't know whether we can unmute. No, unfortunately, you're still muted. Marina, maybe they're asking me if you can leave the meeting and connect again, and maybe in this way the audio will work. Thank you, and we will keep your space for the presentation. Do not worry. In the meantime, as Marina is with us, as I was saying at the beginning, the first part of the panel is identifying the challenges and experiences that the governments of different countries of Latin America and the Caribbean are confronting in the relation and the nexus between climate change, and health. And so, Christina, maybe for you, the first question is, you represent the Ministry of Environment, as you mentioned. How is the Ministry of Environment working in coordination with health and with other relevant ministries in terms of identification and prioritization of climate and health for national planning? Can you hear me? Yes? Okay, well, thank you very much for the question. We are working hand in hand with the sectors and the different sectors of the Ministry of Health. In terms of health, I would like to say that the interpreter is having issues with connectivity. Allow me one moment.
En este tiempo han habido pasos que se ha avanzado mucho con los equipos.
We are working a lot with the Ministry of Health and increasing awareness regarding the problem of health and climate change. And this summer, for us, at the beginning of the year, we had some high increase of dengue in areas where there was no issues in relation to dengue before in the northern coast, in the southern areas, and the Amazonias as well. And this is a clear example for us that, we need to keep on prioritizing health in the climate agenda. And for this, we have been working on studies that can give us information on levels of vulnerability and infrastructure on the centers and institutions. Data that we have is that around 70% of the healthcare institutions have a high risk for dangers, and it is associated to mass movements such as landslides, and this is just an example. Now, from the time period that healthcare has been taken into consideration until now, we have within our NDCs concrete measures to adaptation of health, and with the support of the sector and with the support of getting a lot of cooperation, and that the cooperation needs to prioritize health, because many years ago when I started in the ministry, there was no support for health in climate change. And now we can say that with the effort of many people, there is an interest to be able to support on health issues, and of course concrete adaptations in order to strengthen systems of information, increase and distinguish more, escalate good practices in the different types of diseases and the technical issues as well, and to improve the resilience and infrastructure. So of course there is an agenda. The sector has advanced in order to officialize these type of issues, and so we are on the pathway, and from the Ministry of Environment we're giving technical assistance so that this can be implemented. So this is a very articulated work that we have with the sectors, concrete spaces of coordination, and this can also go to national governments and other regions. So that's what I can share so far. Thank you, Christina. Marina, we have you again. We have you again present virtually, so if you could please present yourself, and I immediately have a question for you. Well, thank you so much. Good morning, everybody. I would like to thank you for the invitation. My name is... I'm the coordinator of environmental health in Argentina. It is a pleasure to accompany you in this space, and from the coordination of environmental health, I manage the agenda of health and environmental issues that affect the health of the people. And one of the topics that we work on is, in a very strong way and with a lot of effort, is climate change and adaptation and mitigation of the healthcare sector. Thank you so much. Marina, Argentina is one of the countries that has developed its plans of national adaptation in terms of climate change. Can you tell us how this has allowed to prioritize and understand what are the activities that need to take place in terms of the nexus between climate change and health? Thank you very much for the question. In our country, we have a national law and minimum budget linked to climate change that has a plan of adaptation to climate change, which is comprised of different strategies that which every sector has been elaborating, and will present the plan. So in that context, we are developing plans of climate change and health with national plans that we have been working with the Ministry of Health, creating a national plan of climate change and health. And this allowed us to generate recommendations of health in relation to climate, heat waves and cold waves alike, working with other linked topics and looking for a strategy at national level that has been adapted and incorporated in many agendas of the government at national and subnational level and every province level, because we are provinces with every national jurisdiction within every province and their lines of work. In particular, working in climate change and health is very much linked initially in terms of adaptation. What to do so that the healthcare system should be resilient to climate, to provide a response before the events of climate change. Now, it's not only important to work on adaptation, but also mitigation. So we have the healthcare sector, and this has a responsibility in a certain sense, and to work in healthcare centers and hospitals allowed us to approach and the reduction of carbon footprint and to take measures to count on a healthcare system not just resilient to climate, but also with reducing emissions and with low emissions. Thank you so much, Marina. And I am going to continue with Carlos, understanding the SICA in Inter-America as one of the countries. I would like to understand that interinstitutional coordination is equally important. How is SECAP working with other and similar entities such as the Council of Ministers of Health in Central America? This topic of health and how to strengthen with the effect of possibly strengthening these alliances. So this is comprised not only with the Ministry of Environment. We have a framework of environmental strategy, and within this strategy we can see we can approach climate change and environmental quality, and within these strategic lines we included many points that have to do with the healthcare system. And within the institution of SICA, we have the Secretariat of the Minister of Environment and Comisca, and currently we are working with the regional agenda of healthcare and environment, which has been prioritized. And before the development of this agenda, we have been working within other sectors and organizations. In the case of with the work that we've been doing with the UNEP and with with PAHO, that has allowed us to unite on the table representatives of climate change and air quality within the different integrating with different countries within the Central American integration system. And so this work that we have been able to input different thematic areas that we have been developing within the framework of this agenda, which is health and environment. And we have been working within healthcare. We've been working the zoonotic aspect, the health and environment. So we hope that next year we will be able to do a meeting at pro tempore presidency and secretariats and close with a ministry council meeting, which will create a roadmap for this integrated system, which is the Central American integration system. And so we need to also work along with this. Each and everyone cannot be isolated looking into these topics that affect everyone. And so for this, we are doing a meeting with the agenda environment energy, where we are working about all of these topics. And so to see how to work on these issues in case of emergency, and also the private emergency systems in terms of health. So we are looking into these different points, and the regional space allows us to follow these topics in all of these countries and generating these joint initiatives. And so we have been working from this very focus, which is another strategy at regional level. The regional strategy of climate change also integrates the different lines of healthcare, and we are updating it currently. And the people from Comisca were participating, where they gave their input in terms of this. And this is a big challenge where we have been working on seeing the impact of climate change, and not just watching climate change, but also seeing how it impacts us and what's coming up, because we cannot. This is something that we need to approach together and within sectors, and join the synergies that sometimes doesn't happen within the countries itself, and have a platform of exchange to have a harmonized focus, and to focus on different areas of work along the lines, to be able to say, okay, each and every one is working within their own expertise, but we are approaching it in a comprehensive manner. As I can, this is an overview that I can give you in terms of the topic. Thank you, Carlos. And I'm going to go specifically towards the providing of services, and I'm going to ask you, how is this affecting the provision of services? You spoke at the beginning of this, at your introductory speech. So these type of vectors such as dengue and malaria, what other diseases are having greater impact with climate change? Hello. So thank you very much for the question. First and foremost, I would like to congratulate all of the panelists and all the online panelists. It is an honor sharing this panel with you. I have been attentively listening to all of the participations, and as a country representing the Ministry of Health of Panama, I am very happy to hear that our brothers from the region are synchronized with what is going on in our region and the entire world, and that each and every one of them, based on the question, have established a pathway of actions in order to confront climate change issues, mainly in health, and they have established a roadmap for it. And in Panama, they have a national strategy has been established with a roadmap to be able to work multi sectors, and we are working with many governments with many ministers in the government, health, environment, and economy and finance, who with a particular strategy we are diagnosing adequately in order to develop a policy based on the situation that we are confronting. The healthcare system of Panama has had to quickly adjust onto the situation, strengthening its structure at national level, strengthening their diagnosis work team. And one of the situations that we have lived through with climate change is the reactivation of diseases that had been in previous years had been well under control. And one of them that has generated an important health impact in the economic and health sector is malaria, because regionally Panama had an efficient control on malaria, and A few cases were there just a few years ago. This last year, 2023, we've had around 8,000 cases of malaria in 4 regions of our country. And we have also seen the development or the increase of respiratory diseases. We have been identifying all of these pathologies that did not have a elevated connotation, but we've seen an increase that has driven us to reevaluate our national policies in order to attend to the diseases that are non-communicable diseases in order to and we have been training our personnel. We have improved our institutions on issues that have greater vulnerability and those populations that are more vulnerable. And so we are in presenting Plan Colmena that has been created by the President of the Republic, and today is a law of the Republic. This plan establishes priorities in greater vulnerability areas such as the indigenous communities and areas of difficult access. And these are the areas where we have seen an increase. For example, pathologies, dengue, such as dengue and malaria, and this has happened precisely in these areas. And we've also had an increase of pathologies in the gastrointestinal areas or systems because of the increase of rains and the overflooding of rivers and issues with our pipings, and we are trying to give all of our efforts in order to strengthen the primary attention or assistance starting in these areas.
We have the responsibility of responsibly diagnose in time with direct policies to be able to strengthen our health system and generate necessary resiliency to contain these pathologies that we have just mentioned. Training the personnel, strengthening the technical teams, the working technical teams in these regions, and to that effect, we need to work in a coordinated manner with the Ministry of the Environment, the Ministry of Economy and Finance, with the health regions, with the local governments, but also to engage the communities of these that are suffering of these problems. We have a National Directorate of Education in Health. We have health promoters, which are fundamental part so that we can impact with education of these situations to the inhabitants of these communities, that we cannot make our policies efficient if we don't get the main affected parties engaged in the process. We believe that working as a team is one way to face the problem adequately, not only at the national level, but also in the regional level. Establish policies with PAHO, establish policies with the Council of Central American countries, including Panama and the Dominican Republic, are developing, sorry for the redundancy, but policies to create more resilient health systems and to strengthen, above all, the first level of meaning primary care. Thank you, Madam Vice Minister. We're trying to adjust the times of this last part of the panel, so please, the panelists, be mindful of time. We were talking about financing and investment opportunities in having access to finance for activities of climate change and health. I'd like to ask Marina, for example, which are the main gaps or the main difficulties that Argentina has faced in this access to finance, could be domestic or international. Thank you for the question. Regarding Mexico, what I can say is the health sector was a transversal axis to the actions and lines of work that the ministry has been moving forward. And we find sectors like transportation and energy, and they have incorporated the dimension of health within their climate change policies. Regarding the regional and international area, Argentina, I don't know if you are aware that in this time, this is the first country in the world that through the Ministry of Health received, there was a green bond financing for climate, the readiness financing. The Ministry of Health is the one who obtained this international, and PAHO was our partner, and we have been working for many, many years, and I don't want to not mention it. And that's why we have a really interesting project. It's been going on for over 18 months, and it's about to come to a close soon. And we were able to work on strengthening the resiliency of the health system, working at subnational and national level, and the importance of being able to approach topics like communications, like climate change and health. We created an observatory so that we can attune with the common denominator everything that has to do with the information that is circulating. And with the PAHO journey, the PAHO team journeys, and Alejandra Ferrero, she's my counterpart. The interpreter apologizes, the communication is broken online. So I send her a big greeting. I think she was going to be in Buenos Aires for many different activities, but we have become the spearhead to incorporating the health sector into the DNC, and we were able, coming back to the question, domestic and larger international region in Mercosur, which are part of Paraguay, Uruguay, Argentina, and Chile. We bring our proposal of climate change, and we have added some actions because there was a lot of interest, and we've visualized in our last meeting in last September the possibility of getting financing in this topic, but strengthening two main ideas: resiliency. The interpreter apologizes. We lost the audio feed. From part of the sector. So the idea was to have a health system that is free of carbon. Thank you. The last question to end up the panel. Coming back to the Panama experience, Dr. Berrio, which are the opportunities that the government is watching over so that they can prioritize and get in domestic or international financing for these actions that you are prioritizing in the country? Personally, with a technical team, it has been my duty to be able to sit down to the negotiating table with entities that can offer financial support to strengthen the health system, and in this case, specifically, establish policies by our government to improve the quality of service in areas of high vulnerability. We think that in as much as we can continue working hand in hand with, for example, PAHO and WHO, in which transversal policies are established to face the situations, not only climate change on health, but all other priority topics. And in the way in which we can develop adequately these policies in our country, then we will be a country who can aspire to financing. Because one of the most complex situations is when you don't have clarity as to where you're headed or what to do, how to implement programs or investments in health. And Panama is one of the countries with a high investment in health, but we need to establish very clearly policies, but we also need to establish being able to have outcomes in the short, mid, and even long term so that our communities can actually see that resiliency is affecting, having a positive effect in an improvement of the primary care, not only in medical services, but having access to drinking water, for example, or have a fair environment that is healthy. So it is the government's responsibility to work with transparency, hand in hand with international entities with whom we have been working, and we have been accompanied to be able to have a more resilient health system. Panama has been categorized as a country that has a high level of development or is on the path to economic development. So sometimes that makes it more difficult for us to access external financing. However, our reality is completely different, because we see that the rich are richer every time and the poor become poorer more and more. So we have to work to close that gap. And the Plan Colmena law establishes to strengthening the basis that can help closing that gap, which are impacting in more vulnerability areas, and that the income or external contributions can strengthen our health system. First of all, in the areas of higher vulnerability, to try to close the gap, take care of our people better, strengthen the health system, and being able to diagnose everything that is being generated by climate change in those higher vulnerability areas. For example, the overflowing of rivers affect rural aqueducts, like I mentioned just recently. So just not having drinking water generates a lot of problems: gastrointestinal problems, dermatological problems, malnutrition. There's a whole gamut of pathologies which are non-communicable that we face in specific areas. So we need to be able to adapt our policies based on the opportune diagnostics in these areas primarily. And the opportunity of having external financing would allow us to aspire to have a resilient health system. Our poorer communities, our children, boys, girls, and adolescents, that's what they are demanding, that policies are pinpoint focus in their needs. There are areas in which access is really complicated. Bringing medication, being able to establish that the health system is adequate for those areas is really complicated. We have a very extensive province in which you can only move through river boats, only pluvial water and waterways. And that's very clear. So any financing that the central government or the health system can receive would be prioritized to impact adequately those higher vulnerability areas. That said, it is a challenge, and we consider the full effort should be focused to impact those areas and be able to have clarity of the diagnostics and the roadmap to bring it forward. Thank you.
Doctora Berrío. Y agradezco a los panelistas por esta.
Thank you, Dr. Berrio, and we thank all the panelists for this very important part of the session. I have 3 takeaways. How do we bring closer health services to the most vulnerable populations? How do we continue strengthening interinstitutional coordination, and that there are big opportunities to continue working together in order to get financing for prioritized actions. One more time, thank you to all the panelists, and thank you for the public in general. Daniel, I pass the floor back to you for the next session. Thank you.
Muy bien, muy interesante.
Thank you, really interesting. Thank you so much for the panel. And thank you, Luis Perez, for helping as moderator.
Our next panel is going to be mostly in English. But before we call the panel, I would like to make an invitation to all of you, because in this next COP28, we're going to have the first time ever a dedicated day for health. So we're going to have a health day, December 3rd, and I hope that you all can join us, if not in person, virtually, and to strengthen the messages from health. Countries are preparing a health and climate change declaration during this event, and that will feed a resolution that will be presented by member states in the World Health Assembly in May next year. And in Pajos region, we're going to have a policy on strengthening health sector action on climate change and equity. So I think that everything that we heard so far, and these distinguished panelists are going to speak now, are going to help us to shape this global framework on climate change and health. So it's my great pleasure to invite my distinguished and colleagues and friends, panelists, Dr. Karen Paulson, who is the regional advisor on climate change and health at the Pan American Health Organization in Washington, D.C., Ms. Emilia Carrera, which is the Director of Health Initiative at the Rockefeller Foundation. If you can join us here, because we'll have a panel discussion. Thank you. Ms. Martina Otto, who is the head of the Secretariat of the Climate and Clean Air Coalition, UNEP, and Justin Lana, who is the Senior Technical Advisor for the Clinton Health Access Initiative. Thank you very much for joining. Again, if people here in the room need interpretation, you can have headphones at the back of this room. So to start, I'll just ask, maybe we can just follow this order here, but just to briefly outline in the beginning, tell us a little bit more of your organization and what are the priority areas of work of your organization in this climate change and health agenda, in a general snapshot of that, if you can. So thank you. Karen.
Thank you very much, and good morning to all. So from the Pan American Health Organization, our agenda on climate change and health is really focused on building sustainable and climate resilient health systems using an equity lens. And under that agenda, we work under 7 blocks, 7 main blocks. So that's where our focus is. One block has to do with governance and institutional structures. So we work closely with the ministries of health in countries to try to help them to position health on the climate change stage, and working with other sectors in countries in order to have that intersectoral ministerial approach to climate change and health. Another block that we work under has to do with planning, and under that we work with countries in terms of developing strategic plans. I think Argentina mentioned online earlier about their Health National Adaptation Plan. There are strategic plans that exist for different sub-regions in the Americas. We have the Caribbean Action Plan on Health and Climate Change, we have Mercosur, and we have Andean Region plans. And these are the strategic plans which have been developed in collaboration with countries, and in the case of the Caribbean, in collaboration with ministries of health and ministries of environment. So that's a very good area that we are working in with countries to conduct assessments so that we can get evidence that's needed. The other area is related to health and health infrastructure and services. So not only looking at the physical structure of health facilities, but also the services. How do we help to make them greener? Because as some of you may know, the health sector is also contributing to greenhouse gas emissions. So we help countries in terms of conducting those assessments and then to put measures in place to reduce the emissions and to make the infrastructure more resilient. Health and climate surveillance, the Vice Minister mentioned earlier in her intervention about issues related to malaria, waterborne diseases, and so on, their foodborne diseases. So we work with countries in terms of getting data, which is very important, to input into a system or observatories, as we would want to call them, with other data that can impact on health outcomes, and then to develop early warning systems that can, in essence, help countries to prepare and also to respond in a timely manner. The other area has to do with health co-benefits. What happens if we do nothing? And this is one of the areas that we really like to work in as a flagship, because we're looking at using tools such as AirQ Plus, looking at air quality in relation to morbidity, mortality, looking at what happens in relation to if we have more green spaces, active transportation. And when we do those assessments, as in the case of Colombia, for example, with air quality, then we're able to put a dollar figure to it, and we can speak to the persons who have the purse strings so that monies can be released to finance climate change and health activities. And just two more. Health and research and capacity building. This is where we work with health professionals and others to raise awareness on the nexus between climate change and health, and also to strengthen those capacities, as was mentioned earlier, in terms of countries having the technical capacities to help to implement some actions. And finally, but very also important, is health and climate financing. So we work with countries to develop a portfolio of projects so that we can access funds from different entities to implement the agenda.
Thank you very much, Karen. Emilia, please go ahead.
Bueno, buenos días y muchas gracias por la invitación.
Thank you. Good morning, and thanks for the invitation. The Rockefeller Foundation launched its strategy to climate change the last month, and this is an interesting moment because it's the first time that as an institution we are all responding to climate change. And within the organization, we are supporting each other in our own strengths, and these strengths are four. One, the health area. We have a long track record of having interventions in health. The second one is food and the food system and nutrition, focusing more in the agricultural system. The third one is energy and our investment in the Global Energy Allowance for a more green planet. And finally, the fourth topic is innovative finance. How are we going to be financing all of these initiatives and needs related to climate change? Specifically in the nexus of climate change and health, when we delve into the topic, we have to go back to the basis of public health. During the morning, we heard that we have to go back to primary care, training of the staff and health workers to understand and work with communities in terms of community participation, approach disinformation or misinformation of climate change, and be very clear with this link. During the morning, it was highlighted also the direct and indirect impact of climate change on health, and to highlight some data. Excess of heat kills 56,000 people yearly in the Americas. 2019, 3 million cases of dengue were reported. It was the highest in record. And the interesting thing about this is that we see that countries are prioritizing health in their plans, in their and disease responses, and in their strategies. And I know that during the panel we'll discuss a little bit further ahead the challenges, but it's an opportunity to see that countries are prioritizing health issues. Now, how to finance this and how to bring this priority into action is something else. And within health, what we want to do is to identify solutions that are feasible. I'm going to leave it very broad now. We want to go back from the specific investment to cure disease to actually see what is the need. We have to cover this sector of climate change and health. And one of the ways is to do this, to talk how is climate change intimately linked to health? How do we include health in climate agenda and vice versa? How do we insert climate in this health agenda? So I'll stop for now, and we will be able to talk about specific examples during the panel. Thank you, Emilia. Martina, please.
Thank you. Hello, very nice to be with you here today. And we heard quite a bit about this already. When we think climate and health, we immediately think about the challenges to our public health caused by natural disasters, heat, aggravated illnesses, increase in vector-borne diseases. We think adaptation and resilience. And obviously that's a really important component, and that I factor under preparedness. But there's also another, it's a dual relationship, there's another aspect to this as well, and that's how do we reduce the pressures, the present and the future pressures on the health systems by taking action on climate. And here I want to introduce our angle to this, climate and clean air. And we at the Climate and Clean Air Coalition, we're UNEP convened, a partnership with 84 countries and over 80 non-state actors, including intergovernmental organizations such as the World Health Organization, the World Bank, I mean, basically those that are on that list as well, and we work very closely with PAHO on this topic as well. And we focus on what we call short-lived climate pollutants. They're double agents. That's black carbon, methane, HFCs, and ozone. And why have we picked that bunch? It's because they are dangerous air pollutants causing directly heart and lung diseases, heart attacks, well, being part of what it causes, chronic and respiratory diseases, and other cardiorespiratory symptoms. And ozone is directly impacting health as well as impacting plant growth. And here we have a sort of indirect impact through the food systems, again, on health. So that's why we focused on those. They are directly impacting health, but at the same time, they are having a high global warming potential and higher than that of CO2. At the same time, they spend less time in the atmosphere. They have a shorter lifetime. And that means if we reduce them, we can reduce near-term warming, so we are able to bend the curve faster. And that is obviously action linked to the deep decarbonization. So this is not to distract from that agenda item, but it's to add onto it. And with that, we actually are able to help reduce some of the immediate adaptation needs as well, some of the vulnerability. And I think it's a pretty amazing area to focus on because it gives us very quickly results. It's also an area where we've been able to identify a whole range of measures, very concrete, targeted measures that build on technologies that are readily available, that are relatively low cost for a number of them, even coming at negative cost, which translates into profit. And that means we have no excuse not to act. We can do this. So there's a message of hope as well in this. We just have to be able to optimize much more for achieving those multiple benefits. Now, in the CCIC, what do we do here? And actually, I should have mentioned the key sectors across which these measures are applied, and that's transport, agriculture, waste, fossil fuels, household energy, and also some of the industrial activities in this region, for example, the brick production. And what we're doing is we provide some key science elements. We heard something about cost of inaction. We have a new study underway to bring more information to this point. We have done regional integrated assessments that highlight the potential that we have in targeted on each of the regions, a concrete number of measures prioritized to help decision making, to help national planning, national policies as well. There's a whole awareness raising component that we work on as well. We have a trust fund through which we can support directly countries. We do this with regard to the national policies and planning, institutional strengthening as well, but also sector transformation, so very concretely actions per sector. We've done some tech demo things as well. And we're working very much on catalyzing finance for scale, because that's where the rubber hits the road and where we need to bring the sectors much more closely together. And I think I'll, for the time being, stop with that point. And you mentioned it as well. How do we bring one topic into the other area? So how do we bring climate into health? How do we bring health into the climate discussion? How do we make sure we have these cross-ministerial activities sorted out as well? Because it doesn't stop between the discussion between the health minister and the environment minister, but we have to have also agriculture on board and transport, and it doesn't make the task easier, but it opens up a whole variety of things in terms of how do we allocate budgets in a very different way. And I'm not saying it's an easy task, but maybe that we can hold as a thought for further discussion, how we can actually make it everybody's case. And I think that's the key, and that's, again, we're coming back to the importance of the figures to make the case. I stop here. Thank you.
Excellent. Thank you so much.
Excelente.
Thank you. So, CHAI, we work around the world hand in hand with ministries of health, doing a lot of activities that pretty much fall under the umbrella of general health system strengthening. We do a lot of surveillance work so we can understand when and where diseases are happening. This has only become more important going forward as disease burdens are going to shift, new populations are going to be at risk. And we believe strongly that if we have good surveillance systems, we'll be able to do better planning, to put new interventions in place, to switch where those interventions are going, or just to have more longer-term vision on what the needs are going to be at central, regional, and local level of communities, right? With strong data and implementation and planning data, we can have a good sense of where our interventions are working and where might they not be working well, perhaps due to changes with climate, perhaps due to poor implementation, or just tweaks we need to make to different tools. But so much of what we do, again, is really trying to strengthen the general health systems to be more resilient over the long term. And when we have the good surveillance, and if we have strong health systems, or stronger health systems, we believe that these systems are going to be more likely and able to adopt new tools when they come online. So just 3 examples of some new tools that we're working on. About 1.5 years ago, we were funded by NASA to develop an early warning system for malaria here in Panama and Honduras. And the idea is to use Earth observation data and terabytes of climate data to better understand how climate has been affecting this increase in malaria over time, as well as to better prepare the ministry for when and where cases are going to occur in the future. So many of these areas where there is malaria that's left in Central America, it takes a flight, an 8-hour boat to get there, and the sooner we can know how to respond, the more likely we're going to be able to reduce the disease burden. More broadly, at CHAI, and we are entering the dengue space a little bit, exploring the world of Wolbachia mosquitoes, and if we can reduce the burden in urban areas or rural areas with dengue, and not necessarily in Latin America, but perhaps places like India, as more and more people are going to have money to buy air conditioning units and have a bigger need to cool down their homes. We're trying to do some market shaping around clean cooling in that space. Thank you.
That's great. And thanks so much for keeping us on track of time. We are good. So We are spot on, and thank you so much for being so succinct, but also so powerful in your messages. So transitioning to a second question for the distinguished panel. What are the challenges? And Martina already started with that. So give us some messages of hope, right? So give us some solutions. Give us, and Justin also took that in and started to say, you know, this is possible. We can do it. So Karen, what are the challenges and opportunities for collaboration in this space of climate change and health that you see, and how can we energize this cooperation? I think you're on.
Thanks, Danielle. Challenges and opportunities. I think we know of probably all of the challenges, but I'd just like to encapsulate it on the 4 areas. And the 4 areas I would want to look at are related to plans that we have developed in consultation with countries. One is under the area of empowerment. We spoke about the need for health to be at the table. Anywhere climate change is being discussed, health needs to be there. Anywhere that the health determining sectors, because as was mentioned, it's not just environment, but the transport, energy, and so on. And so the challenge for us is trying to get into these spaces and to make our voices heard. But I think before we get there, we have to be able to convince those of us within the health sector that it is an important thing and that climate change is impacting health. So that's one area of the challenge. The second one I would think has to do with the evidence. And in that challenge in terms of the evidence, that's getting the data, conducting the assessments. I'm mixing the challenges and the opportunities. So already we started to mention some of the opportunities. So we're working with the countries to conduct assessments so that we get that data. Once we have that data, then we can begin to do our analyses and get the evidence to more make a stronger case as to the links between climate change and health. We spoke of malaria, spoke of dengue. The early warning system would help, and these are areas that PAHO is working with countries on also. So that's trying to answer that challenge of getting the evidence. The other one has to do with implementation, which is linked to the capacities. So we're working with countries to help to develop the capacities in countries because we have a number of generic or more global assessments and guidelines and so on. But some of the issues are specific to countries. And so working with countries and doing the capacity building in countries, then we can work with countries to help them to implement some of the actions that are needed. So I think once we have that, the fourth area I wanted to touch on has to do with the resources, the financing. We mentioned there are some challenges getting access to financing for countries for different reasons. And I believe that once we have, we work with countries to do the assessments, to get the evidence to make the case. We also work with countries to develop a portfolio of projects so that we can then approach the different donors. So once we have that evidence, we can make the case, we can approach the donors, different entities. This is the situation, these are where the gaps are, and so this is where we need the funding to come in. And of course, in terms of the opportunities, a grand one that we have is the partnerships, and that's how we work, and we're here from different entities. And using partnerships is a very good opportunity for us in engaging in the climate change and health space.
Karen, Emilia.
Creo que el espacio de cambio climático.
I think the climate change space and health is fragmented. And so at the same time, what gives me hope is that I think health is the face of climate change, is the way how we humanize climate change. And the climate change crisis is something that we're going to measure in human lives, be it in mortality or morbidity. And so on that end, I feel that I'm very hopeful that because I think all of us can go behind the goal that health is the face of climate change. But definitely there are challenges. And I'm probably going to focus in the challenge of financing that, or the funding that Karen mentioned earlier. And on one end, we see that many countries prioritize health, and we know that 0.5% of the budget to adaptation goes to health, and so there's a huge gap between what's been funded and what is not. But given the opportunity, Rockefeller Foundation, along with the WHO, along with COP28, with Global Fund, Green Climate Fund, we agreed to have a shared vision in terms of participation in healthcare. And these are some principles and strategies that we are putting out to test, and hopefully more people, not just the global finance sector, but also countries, should unite. And this is a funding where transformative agencies should align with resources, and priorities of the country should align, mobilize new funding, integrate new goals in the strategic goals of finance, to have an equitable use of funds, to promote equality in the countries and communities that are most affected, and to support innovative focuses that have joint challenges. And so this gives me hope. It gives me hope that many institutions, many organizations that are giving financing or funding to adaptation and climate mitigation are joining, and we're trying to coordinate with each other. And I think that with the support of this vision, we can advance and work coherently and in coordination to be able to define the shared vision, and in that same manner advance to scalable solutions towards climate. I think that the other challenge that exists is of generating evidence is perhaps maybe we have to ask ourselves, how much more evidence do we need? Or do we have enough to be able to act? And I think that we're in this space where the climate change sector depends on who we speak to. It's not necessarily a new space, but we need to highlight the impact in human lives. And I think there are some initiatives and interesting solutions that we are supporting. On one end, an early warning system, for example, in Bangalore. This is a system that we work with Art Park, which is a company that develops codes and robotics, where at the beginning the idea was to support the city to detect cases of dengue. And at the time when they found the database, an Excel was not talking to the other Excel. They were not in communication. Databases were not able to join. They were not able to join together, and they couldn't measure it. So then we needed to start with the basis, as Justin said, that we need to set up the system, the vigilance system, the data, which is going to be a fundamental structure to be able to then do something else. And so once we achieved the collection of this information of incidence and prevalence of dengue today, we are now looking into more advanced models as to what can we do in order to use artificial intelligence in order to predict the focus of dengue. But for us, this was a learning point to see where exactly are the countries and where exactly are the cities and the countries, and what data exists there. We need to start detecting to what's going on today in order to later construct more innovative models. Thank you, Martina.
Example. So one is preparedness, and the other one is reducing future pressures. And in cooling, obviously, part of the health system, offering cooling centers is sort of something that is a fix to a problem that helps particularly the most vulnerable populations that may not be able to have air conditioning units in their homes and so on in a very efficient manner. So that's one. But at the same time, we can't stop there. We have to reduce the need for the cooling demand, because at the same time, putting all these air conditioning units into place means we're driving climate change again, because that puts pressure on energy systems, and we know all how they function and so on. Even if they're super efficient, this will contribute to the problem. It's a vicious circle that we get into. So that's why we need to also look at shifting things from, for example, district energy solutions to better buildings, to shift our perception that we don't talk about space cooling anymore, but we talk about personal thermal comfort, which is a very different thing because we all experience it in a very different way. Personally, I'm freezing in all the rooms. So here we could immediately save a little bit, but it's something that we need to think through. And then nature-based solutions that on top can help with an air pollution problem, not only reducing urban heat islands, reducing cooling demand in buildings, but it's also recreational space and more pleasant and so on. So there's a whole multiple benefit story that comes in thanks to that if we put our creative minds to it. And that's what I was hinting at, that we look for those kinds of solutions. Now the multiple benefit story, you can hear this is something that really is important to us in the CCIC, and our study for Latin America did find, based on modeling, that those SLCP measures, those short-lived climate pollutant measures across key sectors that have been identified for the region, if we implement them by 2050, we have the potential to reduce warming in the region by up to 0.9 degrees Celsius. We can reduce premature mortality from PM 2.5 by at least 26% annually, and avoid the loss of 3 to 4 million tons of 4 key staple crops each year. And I think that's a good story that should bring us to, okay, how can I work with, well, the ever other sector that is involved in making sure we get to these benefits. And there's a lot of good news in this region because a lot of policy work has been done, a lot of planning work has been done. We've supported quite a number we worked with 9 countries in the region on this planning. We talk about the different planning, actually, and that's maybe something that's part of the challenges, because maybe there's too many plans that we ask governments to do. And we have to maybe coordinate a little more on that, but it's really enabling as well to opening the dialogue with the line ministries because we have those planning processes in place. Yesterday we were in a different setting here upstairs with the Latin American Environment Ministers Forum, and quite a bit of emphasis was put on air quality legislation that already includes health aspects. And I think that's super interesting. So how do we integrate criteria that help us optimize for the ever other topic in the things that we do? So a lot of hope on this. I did say the technologies mostly exist and are low cost. There's no excuse not to do it. And now the finance aspect. And here a lot has been said already, and I want to only hint to 2 opportunities and 1 challenge here. 2 opportunities is how can we change our evaluation criteria for the allocation of finance to have more results-based elements in there to optimize for also health outcomes every time we do something. That means if you look at, for example, our NDCs, that we include already targets that include health targets to unlock some of the climate finance for this. And then something I hear all the time when talking to the financiers, they say money is there. So here we say, well, we don't have the money. The others say money is here, and we have to bridge this gap. We have to get to this point. We connect those societies, and there's a lack still of readily available, a pipeline of projects that are directly fundable. And I think we really have to work on helping people to put those together in a way that it matches the interest and the needs of the funders, and we get the things done that we want to. And the challenge that I promised to highlight is a lot of the actions that we look at the sector scale is going back to local governments as well. And there is a relationship, obviously, local and central government. And if it's in the jurisdiction of the local government, they're very ready to do a lot of things. But it's the access to finance. Often they're not sufficiently credit-worthy to take out loans directly. Sometimes they're not even allowed to. But they need guarantees from the national governments. And I think there's a relationship issue that we can drive forward as well. And maybe a last little point to entice the health community is when you look at all the pressure points going forward, so there will be pressures on electricity grids. How do you become more independent? How can you be part of finding solutions to the climate problem as well? So investing maybe in mini grid systems, renewables, I don't know. Maybe as well looking at putting air quality monitors on a hospital. So to really help with the data collection as well. So there's two immediate sort of things. How can you be part of that climate community in a very different way as well? Thank you.
Very well. Justin.
Yeah, I'll be brief, so don't repeat myself. But no, this is great. I mean, the challenge, right? Climate change is here. We're living it. We're trying to navigate in a changing world without too much time to prepare. And we can think back 3, 4, 5 years, and there's communities all across Latin America that are experiencing a different disease dynamic than what they had before. So that's, to me, the challenge. The opportunity is disease surveillance systems are improving, and where they aren't, I think there is an appetite to improve. COVID, as horrible as it was, I think did a lot for this world in terms of showing us what we needed to know and when, and get countries moving on improving their surveillance. The other opportunity is that technology and science are advancing rapidly. You know, in the era of machine learning and AI, to be able to take regular satellite information and points from all around the world and put them together in some black box of machine learning and spit out some connections between diseases here and ocean temperatures halfway across the world, which seem to be consistent over time, we're going to have new insights into what's happening. But the challenge and the opportunity, I think, at the end is making sure that these systems serve the right people or the ministries of health, right? The best models in the world do nothing if they're not trusted, if they're not understood. And so bringing ministries of health at all levels, local, regional, national, along in these processes to understand what their needs are, to understand what their questions are, and then to tailor make these things in tandem with them is the only way we're going to see them be used. Because the last thing we want to do is predict disease and then just watch it happen, right? We want to predict it, work with the ministries to be able to reduce it.
Excellent, excellent. We are right on time, so I would like to thank our distinguished panel. It was amazing, fantastic. I may synthesize that in a few bullets. I heard you saying about the need for information and strengthening surveillance, developing the early warning systems, but also understanding that although climate change affects everyone, everywhere, it has different effects on different people. So it's not the same for everyone. And the ones that are being most affected are affected by these compound effects of, like also the Vice Minister also highlighted that they are affected with the lack of water, sanitation, inadequate housing, and lack of proper access to health. And climate change on top of that is exacerbating the effects. I also heard you speaking on infrastructure, that health infrastructure needs to be operational, but also there's an opportunity of becoming more low carbon. So I think that that's a win-win situation where we can maximize the gains there. I heard you saying a lot about capacity building, and also health personnel are well-trained and well-equipped as well to tackle climate change-related effects. On intersectoral action, the importance of sitting together the sectors of transportation, agriculture, energy. It doesn't make sense to health only talks with health, environment only speaking with environment. So we really need to energize this intersectoral space. And financing, climate and health financing is a key aspect. Many of you addressed that. And in the end, Martina also raised the need to use health lenses to prioritize policies and interventions that can maximize health co-benefits. So that's very important, because then even policies that are happening outside the scope of the ministers of health are really contributing towards good health or bad health. So that needs to be taken into account. So thank you very much for the panel. We're gonna ask you just to leave the table, because then we're gonna have our last intervention with Carlos Ruiz Garvia, which is our, how many climate weeks we've been together, Carlos? So Carlos is now the team lead of the adaptation unit at UNFCCC in Bonn. So he's a friend of the Climate Change and Health Agenda. He's really an inspiration. And Carlos, as we transition to this Health Day in the UNFCCC COP28, we'd like you to deliver the final messages, the closing messages for this session, and how UNFCCC takes this panel and how we can advance further with a powerful and truly global and intersectoral climate and health agenda from this point on. So thank you very much.
Thank you so much, Dan Bas, for these inspiring words, and I will switch to Spanish for the closing. Tengo la difícil.
I have the difficult task of closing this excellent panel. This is part of the Climate Week, and it is the first one of the session of COP4 and of all of the 4 sessions, and it has a very important role, which is bringing civil society from different angles of society, of health, of the means of life, and also combining it with funding is a topic, an experiment that is very important to have a cross-cutting agenda on all of these topics. And so I'm very inspired by Danielle's words, because personally, it has been, he has been witness to many of the milestones in the agenda of health and climate. I remember 2019 when we had the Climate Week in Uruguay. 300 people had evolved until, the youth that we see today and different stakeholders that continue to add up to the agenda. And so that was our first panel of health and climate, explaining what the Paris Agreement was, the potential link that existed between both, and then we moved forward to participate in the processes of fund development, explaining why health is so important within climate funding, the first meeting of ministers of health, and why is it important that the ministers of health need to speak to the rest of the ministers in order to use instruments and create effective actions. And so this is very important for me, because we have been through all of this, which was pretty much basic, and now we're talking about how to strengthen what already exists and how to better collaborate. So we're looking into a very important agenda, more ambitious agenda. All of this recognizing, of course, the fact that we need to increase the ambition, and science is always there in each and every one of the sessions. My task right now will be to connect the discussions of excellent panels that have, and I'm truly inspired by all of the panelists, especially by the keynote speaker, the Madam Vice Minister of Panama, who showed us concrete actions in terms of legislation, and she truly deserves a round of applause. But my function today is going to be connecting all of those discussions that happen within the process of UNFCCC, the climate negotiations. And so our Secretariat of Climate Change, reminding that the Paris Agreement is going through a very interesting moment with a global balance, recognizing that there are tools available to you in this community, such as tools for adaptation, mitigation, and funding, and you need to make use of this and move the agenda hand in hand with this global agreement, which is the Paris Agreement, and so getting into its first balance. There are very relevant elements in terms of air quality. There are mandates that already accelerate these initiatives that we have heard about today. But in terms of adaptation, there is a very critical moment for negotiation, because along with the global balance, we have the global objective of adaptation. So please use these developments to be able to find coherence and synergy in the implementation of your agenda. The global objective of of adaptation is very important, because in mitigation we have 1.5, finance we have the benchmark of the $6.5 million, and in adaptation we are working on the scheme of Sharm el-Sheikh program in order to for this message. And so this is very critical, because we need this zone so that all of these critical points are going to help establish what establishes science. And so we are establishing the system for after the accelerated efforts of COP28, everything in a coherent and synergized and filled with synergy with a clear objective. I encourage you to work with the adaptation committee that has the mandate of establishing coherence and synergy, and working with them, also giving recommendation and giving them guidelines as to what your sector requires and can provide within other bodies of convention, technology, finances that are also going to be very useful, and you're going to benefit from the experience that you keep on gaining. The topic related to NAPs, NDCs, the plans of actions of the country, the Paris Agreement offers a lot of vehicles in order to work with a lot of modes of working with a more aggressive interaction with the different sectorial lines: agriculture, water, biodiversity, forests, and many others. And so please make use of NAPs. And I think Latin America is an example, along with the Caribbean, of action in terms of NAPs, and use these tools of management in order to better access the funds and the work that has access to finance along with private finance access. There is a very relevant work for this group within the framework of international mechanism of SOBIA, of loss and damages, and in terms of climate, non-economic impacts. And continue with the group, with the work of this group, because they offer instruments that are very useful, and you feed this process that is very important in the decision-making process.
Volver a los NAPs.
Let me go back to the NAPs or the NSS and the long-term strategies. The participation of the health sector are part now of these instruments, and this is a global presence in the global NAPS agenda. In the NDCs, the National Action Plans of countries, PAHO and WHO have established an analysis of plans presented by countries, and there is an incremental effort. In 2019, we saw that 70% of these instruments do have aspects related to health. And in 2022, 90%. So from 70 to 90%. And during this round, we have the opportunity to hopefully make it to 100%. So it's very important that we use these management tools. And this is not enough. We need to make efforts of implementation, including financing in these instruments destined to health is very important. Today, we heard during many different interventions that financing within these funds reaches only 2%. And that's an unacceptable imbalance. And we have to foster through these management plans the access to financing, of course, accompanied by implementation measures like strengthening data instruments, but also in global health issues. Just climate and health are 0.2%. So we have to work a lot on global financing issues. Now I want to change the topics a little bit towards opportunities. As I said, we are going to be learning from the global objective of adaptation from the state, and the chair of the SASTA, which is the authority in this subject matter, will offer the Botswana results, the working group of Sharm el-Sheikh program, who discuss on the opportunities of the health sector with this global objective of adaptation. All of this towards COP28. Daniel previewed for us already that COP28 has a relevant tag or label in terms of health. It will have a fully specific day dedicated to health. And this is something that shows this positive evolution in the sector, but it also offers spaces for the ministers to discuss how the health sector and climate change is really relevant, and it has the potential of changing into a more, instead of reactive, to a more proactive agenda, giving space to discuss what needs to be done to bring investments to improve policies, public policies in the health sector and climate, and also to get to know the socio-economic impacts that must come hand in hand with the agenda of health and climate, as we saw many aspects of equity and many others. This is an important moment to the sector, so I call you to be part of this movement, to participate of these results, whatever they may be. These are results being led by the countries, and the bodies constituted by the convention, such as our secretariat, are fully available to you to support the sector and, of course, make this an action coming hand in hand with science, but with responsibility that we have with our societies. Thank you so much for your time, and congratulations for the excellent panels. Thank you.
Bueno, con eso llegamos.
Well, with that, we reach the end of this panel. I wanted to thank all those who worked so much behind the cameras from this panel. They were on the stage, but they helped to complete and make this a success. I am not going to mention everyone by name, but some that I'm going to list now. All the colleagues, the interpreters that helped make this dialogue possible, the technical team up front who has supported us in the event, and of course our participants who were brilliant with their participations and showed the road ahead. So thank you so much for the day. Thank you so much for everything. And we bring this session to a close. Thank you and good day.